Hey Paul, this is Walter. He's 74. He's a primary prostate cancer patient. We just brought him back from the cancer center for some treatment. And are you familiar with him?
I got a little bit of report from the cancer center.
Okay. He actually he did really well. As we were coming up the elevator here, he's starting to complain of some chest pain and chest tightness. Okay. How bad is your pain on a scale of 1 to 10? Let's get ready to move. Okay. Does that radiate anywhere else? Okay. The last vitals I checked, he had a pulse of 90.
Okay, and from a scale from 0 to 10, where is it now? How bad is it?
It might be like a 10 or 12.
Okay, we're going to get you on some oxygen. We're going to start an IV on you, and we're just going to get you checked out here. It's hardly coming down now.
Yeah.
All right, good. You still having that pain, Walter?
Feels like you're gonna die.
Looks like he's in a irregular, like an AFib with a rapid ventricular response.
Can I paint the crash cart?
Yeah, please. Set it right over there in the corner.
Respiratory's coming with some oxygen.
It's taking a blood pressure on you right now.
Do not feel a pulse.
You don't feel a pulse?
No pulse.
I'll come over.
SCV tech on the
Okay.
monitor.
So let's start CPR.
Okay,
Get his airway.
Tell me when you get to 30, I'm ready with the bag.
Everybody clear? Shock!
Okay. Is somebody giving a time check now that we're going continuous?
Get chest X-ray and consider extubating him.
We've got some motion.
Demo.m4v is a totally wireless and headless high-fidelity adult patient simulator. It allows staff to practice their patient care skills. It also gives them the environment to practice those skills safely without the fear of making a mistake. Through the use of radio frequency ID tags, Demo.m4v can recognize drugs that are given to the patient and will also simulate the physiological response that a patient will have to that medication dose. He has pulses, heart rates, breathing, his eyes blink and acclimate to light, as well as many other features to give the staff the realism they need to hone their skills of care and to increase patient safety.
I have had extensive experience with military medics who have been trained with a simulator that essentially simulated battlefield conditions with noise, darkness, smoke, etc. And what I found that the medics that were trained in that scenario were much better in dealing with the crisis rather than a medic who had all these same standard medical training but had not had that real-life simulation. Every time there is an interruption in the patient's care, that can potentially have consequences not only at the time, but also down the road, 1 week, 30 days, 60 days after the time of illness or injury. This is another way to train people's thought process to take away those interruptions so that the paramedic is used to talking to the nurse in the emergency department in a common language that both people understand and used to coming up with a plan. Who do we need down here immediately? What resources might we need in 1 hour, in 3 hours? Are we potentially looking at a helicopter or ground transfer to Denver for this patient with or without stabilization or surgery or some other interventions? The simulator not only can help with that, but it also helps a lot with team building. It's a lot easier to communicate with someone if you know them, you know a little bit about them, versus just an anonymous voice on the phone or on the radio, which can cause its own communication challenges and frustrations. So I think it's very hard to learn to do such a thing in a classroom. You simply cannot practice those kind of skills by having an instructor give you a verbal scenario.
In many disciplines, from medicine to professional sports to what the military calls muscle memory, the act of repeating a skill over and over again builds competency, which builds confidence. We're able to take situations, subject our paramedics to that clinical environment. They get the experience, they get the reps, so when they actually have to do it on a real patient, they are confident and they are competent.